Aphorism 281. In order to convince of this, the patient is left without any medicine for 8, 10 or 15 days, meanwhile giving him only some powders of sugar of milk. If the few last complaints are due to the medicine stimulating the former original disease symptoms, then these complaints will disappear in a few days or hours. If during these days without medicine, while continuing good hygienic regulations, nothing more of the original disease is seen, he is probably cured. But if in the latter days traces of the former morbid symptoms should show themselves, they are remnants of the original disease not wholly extinguished, which must be treated with renewed higher potencies of the remedy as directed before. If a cure is to follow, the first small doses must likewise be again gradually raised higher, but less and more slowly in patients where considerable irritability is evident than in those of less susceptibility, where the advance to higher dosage may be more rapid. There are patients whose impressionability compared to that of the unsusceptible ones is like the ratio as 1000 to 1. Explanation. In this aphorism, Dr. Henneman has given idea about on the way of cure. Patient is left without any medicine for 8, 10 or 15 days by giving only some sugar of milk powder doses. If the few last complain are due to medicines which are very similar to the symptoms of original disease, then these complaints will disappear in few hours or few days by keeping the patient without medication. During this period, without medicine, if patient follows good hygiene and healthy life habits, then the original disease will not be found anymore. Patient might be cured probably. But if later on traces of the former morbid symptoms appear, they are remnants of the original disease which is not extinguished wholly. This original disease should be treated with renewed higher potencies of the remedy as directed before. If the first small doses must be followed by gradual increase to higher potencies, but in the patients who are having considerable irritability or high susceptibility, the increase in potency should be much slower than in the patients with less susceptibility. In less susceptible patients, increase in higher potency can be done rapidly. Their ratio of patients whose impressionability more compared to that of the less susceptible patient is 1000 is to 1, means highly susceptible sensitive patients are 1000 times more than less susceptible patients.